Hi, my name is Zani Darboliente, and I'm presenting my peer-reviewed journal assignment for week 3. The journal that I chose is titled A Month of Breastfeeding Associated with Greater Adherence to Pediatric Nutrition Guidelines. Research has shown that both breastfeeding and delaying the introduction of solids or liquids other than breast milk protects against obesity later in early childhood. Numerous studies also found breastfeeding to be protective against infant and child obesity. Knowledge of such benefits have shown to help form positive attitudes toward breastfeeding and predict higher rates of initiation among low-income first-time mothers. Although knowledge of benefits of breastfeeding is important, research suggests that it is alone not sufficient to ensure breastfeeding initiation and continuation. The objective of this study is to compare whether breastfeeding mothers adhered to more of the American Academy of Pediatrics feeding recommendation for infants. Women in their third trimester of pregnancy were approached by researchers in waiting room of OB resident continuity clinics in the South, who explained the study and scheduled a baseline interview for those who were interested. What type of study is this? This is a longitudinal study compared the breastfeeding knowledge, intentions, and practices, as well as the complementary feeding choices of 163 ethnically diverse primiparas women over the first 18 months of motherhood. This study wanted to explain to women that first month of crucial in determining the nutrition choices to be made by the mother for her child, as well as herself. Breastfeeding in the first month gives the baby all nutrition as well as immunity needed, and also exceeded the expectation and guidelines of the pediatric nutrition guidelines. The women who did not breastfeed past 4 weeks were later shown for their children to be obese and even slightly overweight compared to the children who breastfed exclusively past 4 months of life. During the pregnancy, women were asked about their intentions to breastfeed, knowledge of the health benefit of breast milk and formula, and the importance of breastfeeding too. At the first visit following a birth of the child, each mother was asked about her breastfeeding practices. For those that reported still breastfeeding, questions about breastfeeding were repeated at every wave of the data collection until a participant reported no longer breastfeeding. The researchers followed the mothers from the first 12 months of motherhood all the way to until 18 months of motherhood. This was the longitudinal study, and they looked at 163 ethnically diverse primipara women. They wanted to see how much knowledge they possess, their intention of breastfeeding, and how long they would go or plan to, and how well they practice breastfeeding. At every postnatal visit, women were interviewed about their infants' eating habits over the past week. Questions focused on introduction of certain foods, as well as the total amount of such food consumed during the week. Mothers were asked to estimate serving and frequency of various food in any metric familiar to them, which were then used to calculate the total ounces per week of the following: breast milk, the formula, the cow milk, juice, soft drink, baby food, baby cereal, finger food, food associated with choking, meat, honey, and fresh fruit and vegetables. This study was to show that exclusively breastfeeding for the first 12 months in the infant's life and delaying the introduction of solids can protect a childhood against obesity late in life. This study wanted to find out how much knowledge mothers had in breastfeeding and why they choose to breastfeed. From the pool of 167 women, 163 completed the breastfeeding practices interview, which was used to create 2 predictor variable. One is the number of weeks of each mother breastfed, and 2 is the 3 breastfeeding categories: mother that did not breastfeed, mother that breastfed for less than a month, and mothers that breastfed 1 month or more. The second group, less than 1 month, was created because some women initiate breastfeeding but only a few days or weeks to assess any difference between the nutritional practices based on grouping or duration of breastfeeding. Data about infant nutrition collected at each wave were used to test differences in food introduction and serving sizes in reference to American Academy of Pediatrics recommendation. The results of this study: during pregnancy, almost all women believed that breastfeeding was nutritious than formula, almost 98% of them, and that breastfeeding was more effective than formula in preventing their baby from getting sick is 94%. Overall, 97% of the mother reported that breastfeeding was somewhat very important, and 98.5% stated that it was somewhat very important for them that their baby be breastfed. Despite this knowledge, the initial postnatal interview found 138 or 85% of the 163 mothers have ever breastfed, while 83 women, or 51%, breastfed their infant at least 1 month, and only 29 mothers, or 70%, breastfed for 6 months or longer. On the average, breastfed for only 11.4 weeks. In exploring if any demographic characteristic predicted breastfeeding, we found that mothers with higher educational attainment breastfed more than the African American mothers breastfed for fewer weeks than Caucasian mothers. And some of the study limitations of this research is: first, since only half of the sample breastfed for at least 1 month and 70% nursed past the recommended 6 months, they were unable to assess whether the longer breastfed duration was associated with even more positive feeding habits. Also, feeding practices later toddler were not recorded. Furthermore, the sample size was limited, reducing statistical power to identify smaller effects. This study involved only low-income, ethnically diverse, prima pares women, and result may not generalize to other types of women. Furthermore, feeding practices were measured for the 7 days preceding the home visit, rather than the exact age when food were introduced. For instance, the data can confirm that a baby was fed cereal by 2 months, but not whether the initial introduction happened much earlier. Finally, feeding practices were self-reported and thus are subject to errors in memory and socially desirable effects. The conclusion of this study is this finding suggests that there is a clear association between breastfeeding for at least 4 weeks and better nutritional choices over the infant's first year, especially delaying the introduction of foods, especially those associated with childhood obesity. Thus, the knowledge of intentions do not explain breastfeeding initiation or continuation. However, when the woman committed to more weeks of breastfeeding, especially more than 4 weeks, they made better nutrition choices for their infants. I do agree the conclusion of this study. It explores new mothers' attitudes, beliefs, and intention to breastfeed, actual breastfeeding practices, and association between the duration of breastfeeding and adherence to pediatric nutrition recommendation for the first year, to explore possible benefits of breastfeeding beyond nutritional value of milk itself. And that pretty much conclude my presentation, and also here are the references or the peer journal that I chose. Thank you.